Hi guys, welcome to our broadcast. So today we are talking about mental health cover, NHIF cover. I know that we've been doing mental health advocacy for a while. This is what we chose to do as Parents Magazine, to just talk about mental health and to just, so that we can just address what the stigma around it and everything, mental health, It's been a journey, and even our last issues, July and August, has just been advocating for mental health awareness, because there's so many people who are suffering in silence, and we just decided to take this as our advocacy. And even more so, to just discuss about peace during this electioneering period and beyond. So thank you guys for joining us. And yeah, so today I'm joined by Maria Adera, who is a representative from NHIF. She'll be telling us more about the NHIF insurance cover for mental health. This is something that has been adopted recently. And yeah, it was from the Mental Health Act that was passed into law, bill that was passed into law just recently, and to just have insurance cover mental health. We've seen a lot of people not, seeking treatment because it's expensive. And one of the things that NHIF has done is to just make it accessible for people to just, to have mental health. Yeah, so we'll be talking to Maria from NHIF. She'll be telling us more on that. And then we can also talk to Dr. Victoria, who is a doctor at Mathare Hospital. I know there's a lot of stigma surrounding Mathare Hospital, but today we want to, just delve into that and just get to know. Thank you so much, Dr. Victoria, for coming on board. We are glad to have you. Please put your phone on portrait the other way, just the other way. Put your phone straight.
Oh, like this?
Yes. Thank you.
Okay.
Good to have you on board.
Thank you.
Okay, Maria, do you want to please introduce yourself, and then we'll have Dr. Victoria introduce herself.
Okay, my name's Maria Dera from National Hospital Insurance, Department of Quality Assurance, Benefits and Quality Assurance. And I'm here to talk generally about the benefit packages aligned with the mental health and rehabilitation, which we've rolled out and offering services to our members. Thank you.
Okay. All right. Dr. Victoria, please introduce yourself.
Good evening, everyone. My name is Dr. Victoria Wamuhoma, consultant psychiatrist at Mathare Hospital for more than 10 years. I've also been in administration in the same facility, so I have interacted quite closely with NHIF and also the struggles that Kenyans undergo in paying their mental health bills. And out of that, I also work in the private sector, but very little. Mostly I'm a public servant. So thank you for this, and thank you for the advocacy.
All right, karibuni sana. I think we'll start with you, Dr. Marie, sorry.
Yes.
Perhaps we can just talk about NHIF's mental cover. I think this is new for so many people. Not many people know about the cover, and even just general cover for mental health with different insurances. But this, because it's something that's coming from the government, perhaps you can just explain to us what it means for a person who is seeking services for mental health, what it means for someone who has an NHIF card.
Okay, generally, the mental health cover, I would say, is one of a necessity need which NHIF has covered for very many years, and it's one of the benefit packages we are looking into to expand it further than what we are giving as the offering currently, just to improve on quality and the need, based on the need assessment that has been there, based on the utilization reports and findings that we normally receive from various hospitals. and being one of the determinant on how we even pay our claims to the facilities. So based on those utilization reports and notification, we are able to define what a mental benefit cover is all, mental health and rehabilitation benefit cover is. And we've aligned it to 3 main issues, mainly touching on the predisposing factors, precipitating factors, and perpetuating factors, which are all broadly underlying major issues that lead to mental health. And based on that, again, we are able also to get the classification or defining what, based on the disease notifications we receive across all the various hospitals which are contracted and accredited to offer those the mental benefit package. And based on that, it gives us what is suitable for international communication on statistics for morbidity and mortality. Of course, reference, it also gives us reference for national and other psychiatric classification, and of course, acceptable and useful information that is able to give us research and clinical work to enhance whatever is already existing, and of course provide education aspect and range of users in different cultures so that it's able to be enhanced. And based on that, we majorly focus on the ICD-10 classification notification, which now we are able to run and even know which particular mental health disorder which particular mental health disorder is commonly found within a particular area. And with that, we're able to even dig further and find out what is it, how can we come in and help so that we reduce the catastrophe of out-of-pocket payment for our members. So, yeah.
Okay.
Yeah.
All right. And that's good. And just to throw a question to Dr. Victoria, there's a lot of stigma that surrounds Mathare Hospital. And this is because we feel like, or even just seeking mental health. And this is because Mathare Hospital has always been, you know, let me say, associated with, not many people can say, I'm depressed, let me go and seek help from Mathare Hospital. People always look at it as like serious mental cases, and there are serious mental cases, and even depression is serious, but people don't really associate it to, I mean, I wouldn't go and say I will go and seek help from Mathare because, you know, so how can we end this stigma? How can we end this kind of stigma with that hospital?
So thank you for that question. First, I would like to say that stigma towards mental health and even mental health services is universal. But of course, it becomes more intense in the third world countries where Kenya is involved, where Kenya is. And one of the reasons for that is the fact that for a very long time, mental health services and mental health institutions had really been neglected. But we must give a commendation for our president, Uhuru Kenyatta, who took a lot of interest in mental health. And we even had a task force being appointed to look into what exactly was ailing mental health. And out of this task force, there's a huge report that came out. And of course, from that report, there were a lot of recommendations, but one of them was financing. Financing just had to be increased for mental health. Number one, to improve the infrastructure of a facility. I don't think it is the illnesses themselves, but it is also the fact that when you came to Mathare, the infrastructure was highly dilapidated. So then that means that you feel like you're not in a dignified place, even though you are alone. So we must give commendation because there's been a major increase in financing towards the hospital. There's improvement in infrastructure, and even the hospital is in a process of converting to a parastatal, which means it will be able to run its affairs a bit more independently. But again, we have the Kenya Psychiatry Association, which is an association of psychiatrists, which is also doing a lot of awareness, either through webinars, and through other things like the May Mental Health Month. I don't know whether you are aware about the May Mental Health Month. For the last
The
3
what?
years, May Mental Health Month.
Okay, okay, yes, absolutely,
Yeah,
yes,
yes. And you know that for the last 3 years, Kenya Psychiatry Association has taken a lot of interest in that. And for the
yeah,
31 days of May, we ran campaigns on Twitter, but also with persons. And this year, we were
yeah.
working a lot with people in the arts. So there is that kind of advocacy. Then there are a lot of webinars. And then we also have the World Mental Health Day, which will be coming up in October. And as
Yeah,
psychiatrists and everyone else working in the mental health field, we also use that opportunity to create more awareness. I think what is most important also is to keep creating awareness about the importance of taking care of yourself mentally. And if things are
absolutely.
really out of order, then you seek for professional help. And we really just hope that in the near future, Madari will be a place where everyone is proud to come and seek for help, because
All
that has now
right.
been put top or as a
Okay.
priority in the agenda. Yeah.
All right. Perhaps Maria, you can tell us which are the facilities that someone can use the NHIF cover to just seek mental health, because we've known and we've heard, and even just talking to psychiatrists, they say that seeking mental health help is very expensive. And so, I mean, just having the NHIF cover is very useful to someone who's just depressed, even going forward with other kinds of mental health disorders.
Okay, thank you very much for that input. And I would say basically with NHIF, we have two main classified type of healthcare providers who are able to offer those services to our members. The first one is, and it's determined with the contract type that they have signed. And we have two main types of contracts. The first one, we call it comprehensive contract, whereby we are saying comprehensive contracts are facilities who have signed a contract with NHIF to offer to our members defined benefit packages without co-charging them when they seek medical, mental health services with their NHIF card. And mostly you'll find most of these facilities basically are faith-based, and of course medium cost and private facilities who have signed that the contract that we will give as per the defined scope without charging the members when they come to our facilities. A good example is like Madare Mental Hospital, which is our major referral hospital, Coast General Hospital, MTRH being one of them. And then, of course, we have the non-comprehensive facilities, whereby we are saying they are high cost facilities that have also signed contract with us with that partial agreement, whereby they will offer services to our members to specific defined benefit packages and are allowed to co-charge members when they seek medical services where applicable. So we are saying, yes, they'll be given the essentials just like what the comprehensive is offering, but if there's more over and above what has been defined within our benefit package, then the facility will be able to will kind of co-charge them, and they have to remove out of their pocket and pay. And so far for comprehensive facilities countrywide, I'm glad and I'm happy to announce that we have close to 357 actually government and medium cost private facilities countrywide, and we have 33 private and faith-based. Out of the 33, the ones which are non-comprehensive are about 10. The rest are comprehensive. So that
You said
is also
357 facilities.
357. That is from the sub-county level.
Sub-counties.
Who are offering basically the main two packages that are aligned to mental health, the rehabilitation, and of course the mental health conditions aligned to the mental benefit package.
I think that is very, very important for people to know, because I feel like we still need to create more awareness, especially to just say how many facilities or the facilities that are offering. Most people will think it's probably just at national level or
Yes.
maybe just county level.
Yes.
Yes. And before I read the comments, perhaps Dr. Victoria, you could just tell us what are the numbers of people, perhaps you can give us a rough number of people who come to Mathare Hospital to seek for help.
Mm-hmm.
So first, let me say something about NHIF in Mathare.
Okay.
So Mathare is the place that you can come in, be admitted, and be paid for your full bill up to 180 days. So
Wow.
basically for 180 days, it's a walk-in, walk-out. So that is very important, except for, of course, those who are coming for rehabilitation services, where we have a different package. They cover only up to 60,000 Kenya shillings. But for the rest of the services, it's a walk-in, walk-out when you are an inpatient. Now, Mathare Hospital being the only psychiatric, or one of the major, apart from Eldoret, one of the major psychiatric referrals places, I took the data for 2021, and in the outpatient department, for 1 year, we see up to 21,000 people for 1 year. In 1 year.
Okay.
Yes, we see 21,000 patients in the psychiatric outpatient department. It's important to also say that Mathare Hospital does not only offer psychiatric services.
All right.
We are an integrated facility that offers maternal, child, and health, immunization. Yes. We have a general outpatient, which has medical officers that see people for hypertension, diabetes. We have an ophthalmologist. So we really see a big number of patients in the outpatients. But for psychiatry alone, 21,000 clients in the outpatient. Of those, yes, of those, in 1 year or in 2021, we admitted 8,390 clients.
Okay.
For the total year. At any one point, Mathare has 500 to 600 inpatients. So if you walk into the hospital today, you will find we have around 500 to 600 inpatients.
Wow.
Then,
okay.
And of those, 47%, the uptake for NHIF has been quite high. So of those patients who are inpatients or outpatients, up to 47% have NHIF, and that's really a great figure. But we are really hoping that, if 100% of those actually had NHIF, it would really be a good thing.
Okay. So how can we encourage people, or how can NHIF, or just continue spreading the word that people can use NHIF to just seek for help, because it seems like it's such a good package. And it's easily accessible. It's only that people are not quite aware.
So, of course, forums like these are important.
Yeah.
It creates awareness and also the importance of NHIF. So thank you for this forum. We've also, NHIF on its own goes out into counties and spreads the message. I know they have a department that is very robust in awareness creation. But also locally at the hospital, we do have a department for specifically for NHIF, and we do active recruitments within the hospital.
Okay.
Yes, and sometimes when people cannot afford at all, the hospital has a vote, and it actually pays for clients.
All right.
Yes, we do have also intakes that people that the hospital takes in.
Okay, I'm going to read some of the comments, and perhaps you or Maria is still trying to get in. I'm hoping she can get in. Just a minute. So Milanoi Seki says, thank you for this forum. Which hospitals other than Mathare Hospital are covered fully by NHIF for mental health patients? Would you be able to answer that, doctor?
So let me just. I'm aware about Coast General. almost all the county hospitals, because
Okay.
several county hospitals have a small psychiatric wing. And then the Moi Eldoret,
The more,
Kenyatta National
yeah.
Hospital, Kenyatta
Okay.
National Hospital, though they don't admit.
Mm.
So yeah, the ones in the sub-counties, I think most of them are rehabs. I'm not very aware of those.
Okay. Let me add Maria. Perhaps she'll be able to answer that. Carol Oren says the only way stigma can be reduced when it comes to Mathare Hospital is sensitizing and creating awareness on mental health. The more we talk about it over and over again, the more citizens will get used to it and look at Mathare Hospital just like any other hospital, the same way we did with HIV. So I totally agree. This is a timely discussion. Catherine Amulundu, thank you. Ruth Mwangi says, yes, Victoria, yes, it's possible to record this. You had asked that. Where can we find the list of facilities? This is a comment by Ruth Mwangi, using the comprehensive and non-comprehensive packages covering mental health. Still trying to add Maria. Okay, where can we find the list of facilities using the comprehensive and non-comprehensive packages covering mental health? I think Maria had mentioned that they should be in the website. Are you able to answer that, Doc? Yeah?
I think they should be in their website, or I'm sure if somebody walked to an NHIF, there are NHIF offices almost everywhere.
Yeah.
Yeah, they're usually very accessible. So I think somebody can even ask that question there, but I think they are on their websites.
Okay.
Yeah, but we'll wait for Maria.
Yeah. You had mentioned about, so you were mentioning the number of patients that, just come to Mathare Hospital. And I just wanted to know, like, among those people who seek the psychiatric services, which would you say is the most sought or is the most mental health issue that many are suffering from?
So
Or seek help for? Yeah.
Yeah, sure. So I'll answer that question in two ways. That the most common mental disorders actually are likely to be anxiety disorders, then mood disorders. So under mood disorders, we have depression, or we have what also people call manic episodes, or what is commonly becoming, or what people might know as bipolar mood disorder.
Okay.
But but the way Mathare is designed, it's highly unlikely that somebody with anxiety disorder will come into the hospital. So again, that's something that we are working in, because it doesn't mean that they don't need help. So even though generally in the community, what we know as disorders like schizophrenia, they are very low. But you'll find that in a place like Mathare, those are the kind of patients that we have in high amounts or in high numbers. The other group of clients that we are having in very high numbers is drug-induced disorders. So either you get a mental illness, either a mood disorder or a psychosis, which is being caused by either cannabis use, alcohol, cat use, or any other substances. Also, I have to mention that Mathare Hospital has a methadone clinic, where we give methadone therapy for clients who have addiction or who are trying to be weaned off heroin. And that facility, we see up to 700 clients per day. So that is the biggest methadone facility in Mathare. So we have schizophrenia, we have drug-induced disorders, and then we have depression. We really see big numbers of depression in Mathare Hospital, and some of them so severe that we have to admit them.
Okay.
Yes.
And all this is, if I just come with my card, I can get help.
Yeah, so it's easy to come to Mathare. I mean, we have doctors in the outpatient 24/7, Monday to Friday, Monday to Monday. Then it's open. Madari is open throughout, like any public hospital. Then walk in, go to the records department, pick your card. Your card will be with your card. If you're an NHIF client, to get the card or the file is free.
Okay.
But if you are not a client, it is 200 Kenya shillings.
Okay.
And then to see a doctor, if you are NHIF, it's free. But if you are not NHIF, it's 100 bob. So that's really affordable.
Okay.
And so you'll be evaluated by a psychiatrist or by a doctor, any other doctor, and they'll evaluate whether you need an admission or not.
Yeah.
Yeah.
Okay. There's someone here asking, how can a private practitioner, in mental health services, non-rehab, connect with these comprehensive packages at NHIF so that clients can access mental health services using their NHIF covers? I feel like Maria will be best to answer this. Let me ask you the other one from Elizabeth before we try and get Maria. Do we have a program taking care of teenagers? We are getting many kids having depression. We need a lot of awareness to kids in schools.
Okay.
Yes.
So we do have a clinic every Wednesday for children. It's a psychiatric clinic for children from age 1 or even below, up to age 17.
Okay.
So that clinic is for children who struggle with mental disorders. Of course, the younger ones mostly are struggling with developmental disorders, things like autism, attention deficit hyperactivity disorder. They could have gotten some brain injury during deliveries and therefore have epilepsy and other behavioral disorders. But as they become older, now the older type of kids that we are now having in the urban areas mostly, they are being referred to us by schools because of either depression or substance use. So we do have an outpatient clinic, and the hospital is currently working on an inpatient where we can start admitting people below age 13 because there's basically not have been a public facility that is able to admit children who need those services below age 13. We've had to send them to Kenyatta Hospital to be admitted in the pediatric unit. So yes, we do take care of teenagers.
All right. Yeah, and I think it's very important because we're having so many reports of even like last week, a child who killed the mother. She was a teacher, I think, in Migori County. There's a lot of such cases. There's a lot of suicide cases from kids. I think it's a topic also we need to discuss and also just reach out to our kids on mental health. Milanoy says there's a time NHIF was covering fully in some private hospitals like Lifebridge Hospital in Roysambu. NHIF now does partial payment. What may have happened to withdraw? Does NHIF cover rehabilitation services like, sorry, I'm trying to read here because of the font. Yes. Maria,
yes,
because
I can answer that
you can
question
answer that?
by saying, so if you are admitted, let's say in Madare Hospital or Moi Eldoret or Coast General, and among the therapies the doctor recommends is occupational therapy. So it will be covered. As we said, if you're an inpatient, it's a walk-in, walk-out. So whether we do investigations on you, blood tests, whether we do radiological tests on you, whether we give you medication, everything will be covered within your rebate. But if you are an outpatient, then it becomes complicated, though you have NHIF. You may have to pay for these services sometimes. So that's what becomes complicated.
All right. Maria, if possible, just I could read your comments from if you can answer through the comments. For example, the question by Ruth Mwangi, how can a private practitioner in mental health services connect with these comprehensive packages at NHIF so that the clients can access mental health services using NHIF covers? and also Milanoy's question on what happened, what may have happened, you know, about partial payments. Now they do partial payments, and before it was covering fully in some private hospitals. So Maria, if you don't mind, you can just comment on the answers on the comment section. I'll read the comments slowly. I think there's a problem adding you back. I don't know what's happening. But yes, thank you, Dr. for those insights. Maybe we can just talk more about some of the issues like drug addiction. And, you know, you've mentioned that this is also some of the severe cases that, you know, come or that show up at the hospitals. And this is also something that people don't know is, you know, comes from mental health issues as well. What, in your opinion, would you say would help, you know, in, reduce some of these cases?
Yeah, so of course for a long time, and even what we struggle with sometimes is to convince clients that there's truly a connection between their substance use and the resultant psychiatric illness they could have. But it could also be the other way around, that someone had a mental disorder that they could fully not understand, and they started using a substance, and they would maybe feel better when they use a substance, and then unfortunately they ended up in an addiction. So it can be either way, that you first had the illness, used the substance, or that you used the substance and then it triggered an illness. So there's that connection, and then of course there is that awareness. All these things are still within awareness and advocacy, just to create create awareness and also educate the public that substances that you are using or abusing could actually lead to a mental illness. Then and of course in our environment the biggest substance is alcohol. People take this for granted, but in reality alcohol really leads to what we call alcohol dependence and addiction, and with it comes a lot of other issues. And then we have cannabis, and then we have miraa, moguka, and then heroin and the rest. Yeah, but of course what is really important is that we continue creating awareness, because sometimes people don't feel like there's a connection, because these are recreational things.
Yeah, that's true. Catherine Namulundu says the families and society at large need this awareness. Most families take a long time to make that decision to seek help for their family members with mental health challenges. And I think this is also very important when it comes to our kids. Like most of the time we don't know, especially teenagers, that they're going through stuff. And so you ignore thinking they're just being a teenager, but in real sense, they have issues. Paul says he needs advice. He gets depression from nowhere. What can he do, Dr. Victoria?
So he can seek help either in Mathare Hospital or from a private practitioner, a psychiatrist. But yes, there's help. He can even look for us in Mathare. I mean, I work in Mathare, and there's help there.
Okay, thank you. So Peter, I hope we've answered you. Onkar asks, is there a free hotline number for a person suffering from mental health issues? Do you guys have that in your hospital?
So on the website, we've just put the hospital number. We really don't have a hotline, because on that number, really, it's not like there's a mental health practitioner. The hospital is still working on that. Kenya Red Cross, if you Google Kenya Red Cross, they have a hotline, and they have psychologists on standby to attend to people with mental health problems and mental health crises. I've just forgotten the number, but if you look Kenya Red Cross, you'll find the number. The other one is Befriend Us Kenya. If you Google Befriend Us Kenya, they have a hotline which somebody can call, and whoever answers from the other side is actually a psychologist on call, and they'll be able to assist you in if you're having a crisis, or they can guide you on how to seek for help. But for Mathare Hospital, we still don't have that.
All right. Okay. So Maria has answered some questions. Replied to Milanoy, we have two types of contracted facilities, which are comprehensive facilities whereby it's walk-in, walk-out when you seek services. We also have non-comprehensive facilities whereby the facility is allowed to co-charge members. I hope we've answered your question, Milanoy. You'd asked why for some hospitals it's partially paid. There could be a possibility of co-charging members. Okay. To Daktari, how do you make sure an inpatient does not leave or escape?
Okay, yeah, that's a common question that people ask about Madare.
Yeah. Yes.
So yeah, we do use two types of restraint. So the first one is chemical restraint. So we do have drugs that when you are either too agitated or when you are too disturbed, then you are injected with these. Fortunately for Madare Hospital, things have improved. So we are using much more newer, modern, and drugs that have less side effects. So these are able to restrain you. And then every single ward in Madare Hospital has a gate.
Okay.
All our patients stay outside the entire day, but we do have a gate, and we do have attendees who take care of clients and ensure that they don't run away. So we do have those type of measures.
Okay. Let me just read one more question. On drugs, our youth are really taking sorry, especially in high school and universities, as we as parents intervene. Can we as parents intervene before it becomes an addiction? By the way, there's a rise of cases of, high school students just taking or indulging in drugs. And I don't know whether it's being oblivious or parents. Have you had the question?
We had lost you for some time.
Okay, my apologies. So we were asking because someone said there's a lot of increase in indulging of drugs in our schools, but our parents seem to be either oblivious of that fact or to ignore it. What more could we do to just enlighten our parents?
So I think the issue of drugs is purely not parental.
Okay.
We all have to accept that the issue of drugs, number one, is social.
Okay.
If you looked at the past, or if you looked at our grandfathers, the way they wanted, things like alcohol were taken probably in ceremonies and by those who deserved to take the alcohol at that time. Then, of course, with westernization, things have become a lot more permissive. And with a lot more permissiveness, then, of course, these are some of the ills that can now encumber our society. Then the other issue, of course, is security. Because I believe sometimes that drugs also move the most with more insecurity or with security issues not being taken seriously. Because we know this belongs to a certain department, and if policing is not being taken seriously, then the drug will become a lot more available. And if something is very much available, then you are likely to bump into it. Then, of course, the last thing is parenting. So parents just need to become a bit more alert and become more active in their children's lives and be more aware of dangers that are facing these children. Because one way or the other, because of the availability of the drugs, your child is going to bump into it. So either you have to use a parenting technique that makes makes you as a parent ensure that your child is alive and aware to the fact that these things are available. We should not be blind to it. We should not behave like we are blind to it. I mean, in estates, you turn left, there are drugs. You turn right, there are drugs. So as a parent, I don't think we should behave like we are blind to this.
Yeah, that's true. Stephen Muendo says awareness and health education is very much needed in schools to minimize or eradicate use of drugs. Steve, thank you. Are you watching from Bungoma, Kenya? This is a great discussion. Yes. Yeah. Okay. Thank you for your comments, guys. And also, we after this discussion, we'll be having like a challenge for questions on. Okay, yeah, it's already there. Yeah, so there's a challenge online. So just go to our social media pages. NHIF has some gift hampers for you. So if you answer some of those questions, we'll be giving you some the gift hampers for anyone who answers the questions correctly. So Maria Adera says the package. Oh yeah, they replied to the same question by Milanoy, were about partial payments. So there's a package. The package is standardized for all NHIF card cover. All right. I hope we have understood how that cover works. So thank you, Maria. I hope we've understood what it takes to have a comprehensive cover and a non-comprehensive cover. So the availability of NHIF certified rehabs are very rare in Kenya. Ruth Mwangi, my question was not answered. Let me just go back to your question, Ruth. I beg your pardon. Does Mathare attend to clients? Oh, Daktari, does Mathare attend to clients who need counseling and no admission through psychologists or counselors?
Yeah, yes. So for a long time, Madari didn't have psychologists. But since the advent of COVID, we now have psychologists in Madari Hospital. So yes, there are psychologists available for you. It's a very recent thing. I think it's now 2 years old, but there are psychologists available in Madari to take care of psychotherapeutic needs.
Okay. I hope we've answered your question, Ruth. Okay. Steve asks if the availability of NHIF accredited rehabs in Kenya is very low. Why is this so? Perhaps Maria can answer that. Why is the availability of NHIF accredited rehabs in Kenya very low? Why is this so? But perhaps with Daktari, I'm sure you've interacted with even representatives of NHIF. You may be able to answer. My other question on private practitioners was also not answered. Sorry, let me just go back to your questions. Ruth Mwangi. Okay. Oh yes. This was to Maria. How can a private practitioner in mental health services non-rehab connect to these comprehensive packages at NHIF so that clients can access mental health services using their NHIF covers? Is this something you can answer?
So I think what happens as a practitioner, you apply to NHIF.
Okay.
Then NHIF comes to do what? To interrogate your facility. Your facility. And you have to hit a certain threshold for them to give you what is called an accreditation. Mm-hmm. So I think that is mostly done for inpatient facilities. Inpatient. Okay. And that's why several private rehabs have been able to have that, to get that accreditation. And of course, once you're a rehab and you've gotten that accreditation, then it means even outpatients you can be able to see. But I'm not aware of somebody going for accreditation as an outpatient or as a small clinic, because I don't think you will reach the threshold that they need when they apply their lists, the ones they use for accreditation. Yes.
Okay, understood.
Yeah.
So someone asked about the availability of NHIF certified rehabs. Maria says Yes, they are there. You can access the list of the facilities on our NHIF website. So please check out their website, www.nhif.or.ke. And also the list of facilities where you can access mental health cover. There's someone who had asked about that. I think you can also find them on their website. Yes, Maria? Yeah, so Joanne says, okay, let me just continue to on that question of accreditation. The number has quite increased. We have so far 35 private and faith-based, 157 facilities. Mostly our facilities are from level 4 to 6 facilities. Okay, so I think Maria has answered that question. Dr. Can dementia patients receive treatment in Mathare? And does NHIF cover for this? Actually, this is a thing that affects a lot of people, dementia and perhaps Alzheimer's as well.
So number one, we know that this is a neurological disorder that is mostly common after age 65. And
Yeah.
still studies and science is trying to find the causes, but also the treatment. So if you come to Mathare, if your client has dementia, what we mostly concentrate on is the personality changes that the person with dementia has. That we will treat. But dementia per se, even in the whole world, most of the science and most of the treatments are still what we call their clinical trials. But yes,
Sorry, we lost you. We lost you, Kidogo. You said even in the whole world.
Yeah, I mean, in the whole world, if you read literature, it's dementia is still not treatable. So even what we treat in Mathare is the personality changes or the behavioral disorders that come associated with the dementia. But yes, we do treat those.
All right. Okay. We've answered you. Joanne, sorry, beg your pardon. All right. There's a comment from Illinois for coverage, and NHIF only gives one hospital per I can't see properly, individual. If the patient is in another area, can they attend elsewhere without pay, especially if they have been admitted in such accredited hospitals? I think let me use my phone here to read. It's easier. Okay, just a minute. So Maria says, okay, we have two types. Are we still there? Okay, Ruth Mwangi says the majority of Kenyans will not be admitted for psychiatric treatment, and it seems that the NHIF cover currently is skewed towards inpatient facilities. What then happens to the majority of Kenyans who need outpatient mental health services? Okay, that's a question. I think you can answer that, Daktari.
So of course, there are a lot of discussions that go on behind the scenes. I mean, psychiatrists, psychologists, mental health experts will go and sit with NHIF and we all sit on the table, deliberate on the shortcomings of some of these packages. And I can say that what has been happening in the recent future is that NHIF has become more approachable. And even some of the improvements that we are seeing is because of the continuous discussions that we are having with them. And yes, we do see some shortcomings, even at our own facility. And these are still under discussion. They are under active discussions. Yes.
All right. So I was reading a comment here by Milanoy. She says for coverage, NHIF only gives one hospital per individual. Beg your pardon. All right. Okay. Just a minute. Okay, I think we'll go on. We'll just go on. There's someone who had said we didn't answer their question on NHIF for private practice.
They want an NHIF for private practice?
But I think that was for the
Yeah,
accreditation, right? So we
yeah,
answered
we
that.
answered it.
Okay.
Yeah,
Okay.
yeah, when they are inpatients, you call NHIF and they come and what do they do?
All right. Okay.
There are measures they come and take and schedules that they come and do some measures at your place and check whether you reach a certain threshold for you to be accredited.
All right. Elizabeth Barza is asking you, Dr. do we have statistics on areas where mental health has most patients? I think I had asked you that before. I also misunderstand some mental illnesses are in the genes.
So causes of mental illnesses are usually many. What we say is that person A could be vulnerable to a mental illness and person B could not be vulnerable. So number one, you have to be vulnerable. And the vulnerability can come in that you could have come from a family that has a tendency to have mental illnesses. That is, it's in the genes. So probably it's being inherited. So yes, you can inherit. But still, even if you inherit some of these genes, you still have to be vulnerable. So then it means there have to be a lot of other factors that have to push you to end up to tip into having the full-blown mental illnesses. And some of these are stressors. They can be economic stressors, loss of job, loss of an income, family stressors, separation and divorce. Those are really big. Losses within family, a loss of a child, a loss of a spouse, loss of parents, loss of loved ones. So it is usually an interjection of several factors coming into play to the extent, it's like a rubber band. There's like a stretch taking place until that point when you snap.
Okay.
Yeah, but we know that genes play a very big role.
Yes, we do. We do. Okay. I would like to read all your questions, guys, but we have to finish this broadcast. But let me just read one more. There's someone who said, Ruth said the majority of Kenyans will not be admitted for psychiatric treatment, and it seems that the NHIF cover currently is skewed towards inpatient facilities. What then happens to the majority of Kenyans who need outpatient mental health services? Okay, so Maria, please answer. You can answer in the comments as well. Milanoy asks, my question is, for example, a patient is seen at Mathare and they visited elsewhere. Does NHIF then apply? Does it apply if they are admitted, since NHIF only allows one to choose a specific hospital? Yes, or does it let me see. Does it work in such cases? I believe Dr. can help. Dr. can you answer the last question as we conclude?
No. That's purely NHIF, yeah.
NHIF, yes. I think Maria, please answer in the comments. Answer Milanoy and also Ruth Mwangi's question. Yes. So, Dr. in conclusion, what would you say? What would you say in your parting shot?
So number one, I would like to say that being a psychiatrist and of course other mental health workers, we actually form a big part of stakeholders in this mental health conversation. And we try to do our part, which means we try to really advocate for government to be more interested in the mental health of its citizens. And some of these, and we have major psychiatrists in this country, you are aware of them, Dr. Njenga, we have our director in the mental health department, Dr. Njuguna, we have Professor Tuoli, and I'm sure the audience is very much aware on all the campaigns that they've done that the mental health agenda should be taken more seriously. So we are stakeholders and we take our role seriously. But also citizens of Kenya are stakeholders, and we know that some of them have formed groups to advocate for better mental health. And just the other parting shot that I can have is that whatever it is as a person that you can do so that the mental health space can become better, because this is becoming a very critical thing among people, then yeah, just do it. Yeah.
Okay, that's true. So, thank you so much, Daktari. Us will play our part and continue just advocating for mental health awareness. There's so many people who are suffering in silence. And, you know, even as we all have a role, if you have someone who is close to you and you feel they are not okay, please just reach out to them. If you are not okay, seek help, because that's very important. Thank you so much, Maria, for your insights. And please, so this broadcast will still be recorded and it will be in the timeline. So you can still answer the questions in the comments. They will remain and people are going to learn from it. So thank you so much for your time. And we hope that we can spread the message more to just seek help. Don't stigmatize mental health. It's okay not to be okay. That's the message. It's okay not to be okay. Please remember to participate in the challenge. We have gift hampers from NHIF to just give our viewers and our participants and our audience. So make sure you join and answer the questions. Yes, should I read one more comment from Maria? Maria says the model is capitation whereby we allocate funds in advance to the facility for pre-planning purpose. Therefore, when you go to the facility, they are able to offer the service to the member. Okay. If you haven't chosen it, then you can't you can't seek services. All right, thank you. Stephen says, thank you for the discussion. Let's have it in another day. Of course, yes, we were planning for this. Thank you so much. Be blessed all. Stephen says, thank you. This great discussion was timely. Elizabeth, thank you. Thank you so much for the topic. Thank you guys for joining us, and spread the word. You can spread the broadcast as well for other people to just hear about the NHIF cover. Yes, thank you so much and have yourselves a lovely evening.
You too. Thank you for organizing this. Thank you very much.
Okay. All right.